There are studies that show in human beings that there's almost a doubling in risk of autism in children that are the offspring of mothers that took antidepressants, especially during the first trimester. There are issues with fetal heart abnormalities. So the risk of having a heart abnormality in a newborn is 1 in 1,000 amongst human. That's healthy women. And amongst women that are taking antidepressants, it's about 2 to 3 out of 1,000. So it's a doubling or a tripling of the risk of a fetal heart abnormality. It's not a huge risk, still 2 or 3 out of 1,000, but it is an increase in risk. There's an increased risk of lung issues in the newborn called persistent pulmonary hypertension of the newborn. It's rare, but it has been associated with a 2 to 6-fold increase with antidepressant use. Preterm birth is more common with an antidepressant. Postpartum bleeding, I've already mentioned that serotonin affects bleeding, and so that's true for women when they're bleeding after giving birth. Low birth weight, small for gestational age is also a risk for after antidepressant use. And then there's a withdrawal syndrome for the child on birth because the antidepressants cross the maternal placental barrier, go into the fetal brain circulation, and affects the developing brain. There's a great obstetrician in America called Adam Urata who says very simply, look, these drugs are designed to affect the brain. That's what they do. And that's also true for the fetal brain as well as the adult brain. And so those are just some of the risks. There's also some studies that show, poorer IQ, longer time to develop both motor development like walking as well as language development. So I think there are a lot of issues with taking antidepressants during pregnancy, and I don't think it's clearly outweighed by the benefits of staying on them. So I think that has been very badly misrepresented to the public.